Dr. Jennifer Pennoyer is a board-certified dermatologist in Glastonbury who is the first to offer CoolSculpting in our state, and women are lining up for this fast, easy way to freeze off fat.
For those of us who don't have a lot of time to dedicate to excessive dietary training and all sorts of athletic endeavors, this is perfect because those resistant, hard-to-treat spots can be treated within an hour.
I had to see this. Stacy Silk Rome wants her muffin top gone.
I'm here because I have a patch of fat right here that I cannot get rid of. I probably do sit-ups every single day, 100 sit-ups, and it won't go away. So I'm trying CoolSculpt.
Basically, we have 3 different hand pieces, and what we're trying to do is see where I can get the most fat pulled in so I can get the best result for Stacy. The most I can grab in and get into that roll, 25% of that fat will go.
The fat is marked and a gel pad goes on to protect the skin. The ideal spots are rolls that Dr. Pennoyer can tug on, so the CoolSculpt machine can suck in the fat and freeze it off.
Ready, Stitch?
25% of fat cells treated will die off, and your body gets rid of them naturally over about 3 months.
It feels like my skin is being clamped, so it's uncomfortable, but it's not painful.
Stacy's results will be permanent.
You and I are born with a certain number of fat cells. Those expand and contract as we gain or lose weight. So what's interesting with this is you're getting rid of those fat cells for good. So if this is your problem area, which every time you gain 10 pounds over the holidays, it gets worse, well, that's no longer going to happen. This is based on the principle that fat freezes first before skin.
Doctors learned about this from the case of a kid sucking on a popsicle too long. His fat pad in his cheek died, but his skin was okay.
Is it safe?
It is. It is FDA cleared, and it is one of the only non-surgical ways of removing fat that is generally with little pain.
By the way, Dr. Pennoyer is a Harvard and UConn-educated dermatologist who does this to herself. So far, Stacy's doing great.
We're about 5 minutes in or so. Now you're saying it feels frozen?
Now it feels cold, so I still feel a little bit of the tugging, but it just feels very cold. It feels like it's frozen. Sort of like if you stuck your hand into snow.
What's the difference between this and liposuction? Why would you choose CoolSculpting?
Liposuction is great and has its own benefits, but that's a surgical procedure. That you've got to be sedated.
With CoolSculpt, the patient is awake and no painkillers are needed.
I can do my work while I'm waiting for the hour for my fat to freeze off.
Now that's multitasking.
So now we're about 15 minutes in. What are you feeling?
Now I feel nothing.
The whole procedure will take about an hour. Then Stacy can go right back to her regular life. Gradually, the fat disappears and she can buy smaller clothes.
Let's see Stacy's. You guys are here before we talk. Let's see your before and after. Stacy, here's your before. And this was taken about a year ago, right?
Yes.
And there's the after. Stacy, I have to say, you're very brave to go on TV and show us all this, and thank you so much. But I think people are really interested. Are the results what you expected?
Well, look, Ma, no Spanx. So far, so good, and I still have further to go because I'll see the full results probably in another couple of months. So, so far, I'm thrilled.
Oh my gosh. And so Dr. Pennoyer, that's something important to people know is there's nothing being injected in you, there's nothing taken out, so your body's going to get rid of those fat cells over about 3 months.
3 to 4 months you'll see it. I noticed it on myself in about 2 months, but it was nice. I didn't have any needles, I didn't have any downtime, no special diet, no supplements you had to go on. I sat in the office for an hour and just did it.
How many times do you usually have to get it done?
Once, really.
Just once, depending on...
have people come back and want a different area. Once you see the results, you find some other places that you might like to lose it. So frequently people do come back for more.
Thank you both for being here, Stacy and Dr.